We are back, and we are joined now by Katheryn Houghton, KFF Health News Montana correspondent covering health policy and politics, access to treatment, and the business of healthcare in the state. Katheryn, thanks so much for coming on the show.
Thanks for having me.
Of course. So, let's just start a little bit, I think, by talking about the Medicaid cuts in general, and the one big beautiful bill and what the cuts entailed. I mean, it's the largest cut to the program since it was created. I don't know how many decades ago, over 50 years ago at this point. Math off the top of my head isn't a strong suit, but it's basically gutting the program. Is that your assessment of it?
Well, the story that we're looking at is really focusing on the work requirement component of it. And so
Right.
it's setting up a lot of new hurdles and rules that people who are enrolled in Medicaid are going to have to work around. And we know based on what we've seen in other states that have done this, though there are few and some of the examples are short-lived, we know that that does cause people to lose access to their coverage. And often because of paperwork problems or confusion on how they actually prove that they're meeting requirements. So we know that there will be a drop in the number of people enrolled in Medicaid because of these work requirements. And just broadly speaking, some of what the federal changes that are coming down the pike will do, will require people to show that they are working 80 hours a week, 80 hours a month. And so that can translate to an actual job, or that can translate to school, or there are other kind of small list of exemptions that people may fall within. And so there's still a little uncertainty of like the rules that states will have to live by to implement checks on that and see whether or not people are meeting those reporting requirements, and how they'll actually stand up reporting requirements on a state basis.
And so these work requirements, that you wrote about that and how there were already over a dozen states that were trying to implement work requirements for Medicaid prior to the passage of this bill on the federal level. What was the status of many of those efforts, and how does that impact it now coming from the federal government? The paperwork, the red tape, all of that.
How do those things kind of come together?
Yes, yes, yeah.
So I would say, so we found, and I think it was 14 states that either have plans in the work to implement their own form of work requirements or have announced their plans to implement work requirements. And so a lot of these examples are states that have been trying to work towards this for a really long time. Like you said, I am based in Montana. I know that lawmakers here had approved work requirements in 2019. And so for a lot of reasons, states, for the most part, have not been able to do that. Some of that is because of court cases holding them up, delays in the first Trump administration to actually go through that process, or the Biden administration blocking such efforts. The states that we were looking at, many of them were trying to implement rules that, again, lawmakers had already established years in the past. Some were moving ahead quicker now that President Trump is back in office, saying like, we're gonna get a green light for this now, so we might as well keep moving forward on it. In Montana's case, it's really interesting because it was the first state to release a draft plan for its own form of work requirements after the federal government had defined its standards and after President Trump had signed work requirements for this program into law in July. So it's an interesting kind of case study of how states may be shifting. And so as far as how these things intersect, there's a big question mark still, I think. And so in Montana's case, we see that the state largely aligned its plan with what the federal government has already laid out as the blanket rules that need to be put in place by end of next year. But there are some areas where the state puts a little tweak to the program. And I think there's uncertainty and whether or not that will be allowed. And so we're seeing that with a lot of state plans. There's a lot of overlap. The goal is the same. If you want access to coverage, you have to prove you're working. But at the same time, states have their own little forms to what that could look like. And there's a lot of questions of whether or not that's going to be allowed.
And why are states attempting to kind of put their own spin on it or flavor? Is it because this legislation was in the works prior to the passage of this bill, or are they trying to be more draconian than the federal government? What's the motivation?
So it varies. I would say a consistent theme is a lot of these efforts were already rolling in place years back. And so they're trying to follow through. These are state Medicaid agencies, in a lot of cases, trying to follow through on what lawmakers already established as their set of rules. You have some states that, and it's interesting, Montana actually kind of softens what the federal government would require. And by that, I mean, they have a longer list of people who would be exempt from work requirements. The federal standards do lay out some exemptions, people who are medically frail, low-income parents, but Montana's list actually goes longer in trying to kind of buffer vulnerable populations from having to do these reporting requirements. For example, they lay out people who are fleeing domestic violence wouldn't have to meet the requirements for a time. People who are without housing wouldn't have to meet the requirements for a time. You also have states, though, that are going stricter. And so I think Arkansas is one of the examples of that, where they actually say no exemptions. You have Arizona that has said that they are going to largely align with the federal standards when it comes to work requirements, but they're trying to implement different pieces that maybe are kind of tangential to that. And so an example of that is with Arizona, they're trying to create a lifetime cap on how long somebody can tap into Medicaid if they are capable of working. So there's a lot of variety in whether they're going softer or stricter than what the feds have established.
And the roadblocks that they ran into prior to this, right, were the courts or the Biden administration kind of holding it up. Is that do they now kind of have a legal basis to do this? Does that change because the federal government, the bill that passed, has created an opening for some of these work requirements? Like, I'm just flummoxed as to how the states think they have the ability to even tweak this at all, given the fact that some Medicaid is, enshrined into federal law, and the Affordable Care Act with the Medicaid expansion, states had the opportunity to opt in or not. It seems odd that they're trying to now try to work around it.
Sure. So I guess important context is that states have been able to put their own twist to some Medicaid programs for a really long time. That's through something called a demonstration waiver. And so the idea behind those waivers is if there is a policy gray area, states can apply to the federal government and say, hey, we want to do something kind of wacky with this. We want to do something innovative with this and see if it works. What is interesting here is work requirements used to be a gray area. It wasn't outlined in Medicaid prior to this new law that's coming in place late next year, but it's no longer a gray area, right? The feds have said, these are the rules, these are the base, right. This is the baseline, this is the floor. So I think states, the federal government did leave the door open for states to apply through these waivers to try to stand up programs sooner than the late 2026 deadline. I think that the big question we hit after that point is if states are trying to do their own twist to it, is the federal government going to view it as a policy gray area now that there are standards? We did contact the U.S. Department of Health and Human Services to ask about this. And the summary is kind of we'll see as well, which is what we were hearing from a lot of sources. But I think the language that we were sent was something along the lines of we're analyzing to see how these state waivers are going to interact with our new federal standards. So again, a lot of question marks. I will say now that there are federal standards, those states that are trying to push ahead and stand them up sooner, but are following the federal standards are probably less likely to face court issues or court challenges. But states that are going a step beyond, like Arizona with the lifetime cap that they're considering or that they're seeking, they're going to be more open to litigation. And that was based on health policy law experts we spoke with for this story.
I'm a little bit shocked about Arizona. Don't they have a Democratic governor still? Katie Hobbs is still in power, and they're looking at additional work requirements?
State legislatures are wild. So I think you have to look at the whole mix in government.
Okay, fair enough. So you also had another piece where you spoke to somebody, a man who goes by James in the piece, speaking about how with these work requirements and with this attack on Medicaid, it's going to be quite difficult for James to hold on to his health coverage. And there's a quote in your piece saying, "I don't want to be a fraud. I don't want to die. Those shouldn't be the only two options," because he's basically considering having to not be entirely truthful because otherwise he's going to lose some of his health coverage, right? I mean, this is the bind that this is putting some people in.
It's interesting. James' experience, he's actually already not reporting accurately. And that is because Montana requires that if you fall outside of the range to qualify, so for people in our state, that means if you make more than 21,000 plus a year, you no longer qualify for Medicaid. And that's known as the coverage cliff. So James has already hit that. And part of the reason why James hit that is because Montana no longer requires eligibility or allows the eligibility to extend for a year. Instead, you have to report within 10 days if your coverage has changed. And he has a low wage job. That means that his hours change week to week and means he can bounce in and out of qualifying for coverage. So he's not reporting when he falls out of coverage, out of qualifying for coverage. The federal rules mandate that if you are capable of work, you have to prove every 6 months that you are meeting the requirements to work. That is a shorter window than what some states are considering and what some states have in place right now. A lot of people are advocating, folks who kind of study the safety net system say, hey, coverage should be a window of a year. Once you qualify, you have it for a year so that you have time to adjust if you do get a pay increase. The new federal standards mean that that window will be tighter, which means people will fall off that cliff sooner or could fall off that cliff sooner.
And there are a lot of people, and I think James might be included in this, who have to basically, or there's been reporting that they're saying no to promotions or to higher paying jobs because those jobs don't guarantee health care, and then you would make too much money to qualify for Medicaid. This is like a pervasive problem that existed even prior to this assault on the program.
It's definitely a longstanding problem. James was an example where he initially said no to a pay increase. And then realized he wasn't going to be able to save up enough money to afford rent in town. It's an expensive place to live. And he was transitioning outside of an addiction treatment program that came with housing. And so he initially said, hey, I don't want that dollarish wage increase because I'm scared to lose Medicaid, and then realized that meant he may not be able to find housing.
I just want to, there's this graph that I cite frequently on KFF about the number of people, the proportion of folks who are on Medicaid with what their, it says work status and barriers to work among Medicaid adults here. This shows the proportion of people working full-time. This is from data from 2 years ago, but 44% working full-time, 20% working part-time. And then these were, excuses that are given or that you can file when you're applying for Medicaid, not working due to caregiving, illness or disability, school attendance. You see there that only 8% of that pool cites not working due to retirement, inability to find work, or other reason. Everybody else is either working or caregiving, have a disability or illness, or are going to school. So that 8% is apparently the group of people that are responsible for all this waste, fraud, and abuse, according to the federal government. But my understanding, and I'm wondering if it is for you on the ground, is when we're talking about fraud or Medicaid fraud, it's usually on the provider side.
Yes, and so there's actually a federal agency that is watching this, and the cases of fraud that they've identified is on the provider side.
Yeah.
It's really hard to know how often that's actually happening with individual patients, but most often the system's really confusing. So researchers I spoke to about that idea have said more often people aren't tapping into the program when they are eligible because they don't know they're eligible. The system's so confusing, it's hard to kind of work within it to commit fraud.
And but James not being entirely truthful if his income is higher than the threshold on 1 week, that would be what is they would consider basically a fraudulent usage of the program, which is insanity because this is like, how can you fraudulently try to maintain your health insurance? It's not like this is a cash payment. It's not like you can sell your Medicaid card to somebody else. This is somebody that is just trying to hold on to the health insurance that they have.
James is a really interesting example because he is what he's an example of someone who the system is working for, right? Like a year ago, his body was breaking down. He was really unhealthy. He was not able to keep steady work because of his reliance on alcohol and his addiction to alcohol. Now he has a steady job. He's going back to school to become a licensed addiction counselor. He's doing well, and he attributes that to his access to Medicaid and says if Medicaid goes away, he is scared. So he is interesting in that he is both. There are people who say there's no waste, fraud, and abuse. He's an example of someone who's breaking the rules, and he knows he's breaking the rules. At the same time, he is kind of the story of the hope for a program like Medicaid.
What do these work requirements look like in practice? Sorry, there's a dog in the hallway. What do these work requirements look like in practice? They clearly, I think, set up way more barriers to people accessing Medicaid. But I'm wondering with this added paperwork requirements, both from the federal level, but also now these over a dozen states that you write about. What does that look like for people trying to get access to healthcare?
So right now, the U.S. has one state that has active work requirements, and that's Georgia. And those rules have been in place since 2023. I've had colleagues who have been following that for years. We have a coworker who's on the ground there who's really been tracking this. But what my colleagues have reported is that Georgia's experience shows that implementing work requirements can be really costly for states, really confusing for enrollees or wannabe enrollees, and can also have ripple effects into other programs that state Medicaid agency staffers are also working in. So if someone's trying to tap into food assistance or staff assistance, they're often trying to reach the same people who are managing Medicaid and trying to answer whether or not people are meeting work requirements. And so we've seen with Georgia that they're one of the states that have a waiver that had already gone to the federal government before these national standards were established that tries to roll back its program a little bit. Initially, Georgia wanted to do monthly checks on whether or not people qualify. The requests that they have in place now and are still waiting to see if the feds say yes or no is to do that every year. So again, that's switching from month to month, which I don't believe the state ever actually implemented because that's a big administrative burden, to annual.
Cost. Yeah.
It's cost and time for states.
Right.
And it was a colleague of mine, several colleagues were following this and had said at one point there was a report that Georgia's released that actually said they're having a really difficult time actually evaluating whether or not people are meeting the requirements, which of course is like the reason to do work requirements, is to see whether or not people are meeting that bar.
Unless your true motivation is to keep more people from using the program, right? I mean, like that's essentially what happens at the end of the day is when you create all of these barriers, like you just spoke about how there are so many people that don't even know that they qualify. Well, what happens to people who do know that they qualify, but they have this incredibly burdensome paperwork situation that might, make it difficult, or perhaps they're worried about constantly having to file paperwork or interact with the government in this way. Like, it is designed to be confusing.
Arkansas actually showed us, so it was, I believe, 2018 that Arkansas had stood up its work requirement program. And it was interesting. A judge initially deemed that program was illegal, but before that happened, there were 18,000 people who lost coverage. And reporting from coworkers in my newsroom showed that, and reporting from a lot of places actually showed that a lot of people were just tangled in the system. They didn't know how to report their hours. They didn't know they were supposed to report their hours. Or they weren't able to reach help when they were trying to, because there was a logjam for caseworkers.
Well, lastly, Katheryn, what is your kind of estimate for the short-term immediate impact of some of these work requirements, like, or your maybe not numerical estimate, but what do you think is the likely outcome with many of these states, and what we're going to be seeing in the next coming months when it comes to people kind of being jettisoned off their health care?
Sure. So I think that it is interesting. States have until, again, the end of next year to try to stand up these programs. I think we're going to see a number of states asking for extensions to that, because in some cases, every state is coming from a different place in what they're tracking. So some places have systems that maybe could work to track this, or a good starting point to track this, and others are starting from scratch. So I think we're going to see a lot of variety in whether or not states are ready to try to do this, whether or not they're trying to do it early or push it off a little bit longer. I think there's going to be, it's going to be similar to when states were doing Medicaid redeterminations. So after the emergency protections were lifted during the pandemic, you saw that the nation, every state had to reevaluate whether or not people qualified for Medicaid. And that big administrative load on states meant that they were overstretched in a lot of places. And so you may see longer waits for people to access caseworkers to talk through their application or their problems with Medicaid. You're going to see states trying to juggle an awful lot to catch up to what the standards are supposed to be.
Well, Katheryn, I really appreciate your time today. You can check out the coverage of all of this stuff at KFF Health News. Really appreciate it. Thanks so much for coming on the show.
Thanks for your interest. Bye.
Of course.
Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.